Can a single question paper define the kind of doctor you will become? Hundreds of days of hustling, of sacrifice, of studying your brains out, a 3-hour examination and it's all over? Does that one moment truly define the doctor we will become? Let's understand this. Hi, I'm Dr. Somlina. I have recently completed my residency in MD Radiodiagnosis. The answer to this question is not easy because when you become a doctor and start practicing in real life, things become a bit complicated because you're not expected to be that one-dimensional, nerdy individual that you were during your school days, during your MBBS life, sitting with books 24/7. You are expected to have a lot more qualities which are very crucial for surviving in this ever-evolving field of medicine. So let's understand this. What are the qualities required to become a doctor? Let's start with this. What the mind doesn't know, the eyes cannot see. So obviously, first and foremost, a knowledge of the core clinical concepts is absolutely necessary, for which we have to study from our books. And yes, this skill is tested in these examinations, no doubt. Second, discipline. Doing the same boring things till the day of the exam. Reading 10 hours a day, giving regular mock tests, going to bed at a specific time and getting at least 7 hours of sleep daily. All these come under what we define as a disciplined life. And yes, the NEET PG examination teaches us that also. Why is discipline needed to become a good doctor? Discipline keeps you organized, ethical, efficient, enabling you to stay on track with studies, follow protocols, manage time, and deliver timely, high-quality care even under pressure conditions. To acquire all these qualities, NEET PG examination and its preparation definitely helps. Third one, critical thinking and decision-making. Yes, to some extent, because we now have clinical scenario-based questions in our MBBS professional exams also, as well as in our NEET PG examinations. So yes, decision-making, critical thinking, theoretically to some extent, we can gain while preparing and giving NEET PG examination. So coming to the next quality, that is empathy. Suppose a very young boy has been admitted under you recently. You have taken the history, done the examination, and you realize the chances of this young individual making it is very dim. So what do you do next? You talk with the family. See, you have admitted your patient, but don't expect anything, okay? There is no hope for him. Pray to God if that helps and sit quietly. Is this how you're going to speak with the patient? Just because you are frustrated and you are tired by working all day? No. For you, every patient is the same. No one is more important. That's okay. But for the family, he's the only child in their family. So much so that the family, the mother or the father, they are ready to die if that is required to bring their child back to life. So is this how we are going to behave with that patient's family? No. Even if you are frustrated in your personal life, the patient's family does not deserve your egoistic attitude. You sit down with the family, make an eye contact, and then speak softly. This is an incredibly difficult news to share, and I can't imagine how overwhelming this might feel for you. Despite our best efforts, his condition has reached to a point where there is very less chance of recovery. I want you to know that we'll keep doing our best and support you. Please let me know if you have any questions or if there is anything that you need during this. I'll be there. So when you are using this approach, it acknowledges the family's emotions, offers compassion, and provides reassurance of your continuous support, of your continuous help. This is empathy. Do we learn empathy while preparing for a test or while giving a test? No. We learn empathy from our seniors, from our colleagues, or even maybe our juniors, and trying to understand the point of view of the patient's family, even if the entire day has been very taxing and tiring for us, because our duty deals with life and life is precious. The same goes for the next trait, that is your communication skills. If, for example, suppose as a radiologist, a young female patient comes to me with lower abdominal pain, acutely occurring, and I see a complex cyst in her adnexa, and I reported it as a hemorrhagic cyst. But if I had taken history from the patient, or from the primary care physician, because I did not have any time, or maybe I was uncomfortable to speak openly with the patient or openly with the primary care physician. I did not get any time to discuss with them the history of the patient. If I had done so, I would have known that this girl had a period of amenorrhea for 2 months before this episode. Her urine pregnancy test had come out to be positive, and thus what should have been reported as a tubal ectopic gestation sac, a tubal ectopic pregnancy, I would be reporting it as a hemorrhagic cyst, which is a complete utter failure from my side as a radiologist, because I failed to diagnose an emergency condition which needed emergent surgical attention. Hence, talking and developing a skill for doing that talking tactfully, so that you can extract out the history that you want from the patients, and at the same time communicating with the primary care physician, knowing what that person wants to know, is extremely essential for you, be it any stream. But who will teach you these communication skills? Your books? Your NEET PG examinations? No dear. You will learn these with time. Another related skill is the spirit of teamwork. Now, this is essential mainly for clinical branches. When a new patient is admitted, the one who is present on duty from that unit will write down the history, perform the clinical examinations, send for the initial investigation workups. Someone will draw the blood and send the blood investigations. Someone will make sure that the imaging investigations, the ultrasound and the CT are done on time. Someone will compile all these together and communicate it with the senior professors, and someone will take him for the preoperative anesthesia clearance. Now, if you do not want to share the responsibilities, share the work with your team, and you take responsibility for each and every task and try to do it on your own, you might feel that you are doing a very great thing, but you will fail terribly, because it is not humanly possible to do everything and do those things with the utmost sincerity. We need to learn to divide the work within our team members, keeping in mind which thing is done better by which person, and make sure that everyone is doing their bits properly so that the work as a whole is benefited. Always remember, the patient and the patient care are much more important than your individual unbun with each other. So even if you're not so much friends with someone who is in your team, you still have to behave in a professional way so that the work is not hindered. This is also something that our NEET PG preparation would not teach us. We will learn these things while working with others. Another is adaptability, making yourself so flexible that you can work in different environments if you're exposed to it. Suppose you're posted to a place where there is no MRI machine, but still you have to diagnose a stroke. But CT scan is present, so you should be able to diagnose the early findings of stroke on CT, though they are very less evident, but you have to make yourself proficient in finding out those findings on CT. Similarly, suppose the usual medication that you use for certain condition is not available in a very peripheral institute that you are working. You have to find out its alternatives. So to conclude, a 3-hour examination may test your foundation, but the qualities which actually define a doctor in the long run, like critical thinking and decision making, empathy, communication skills, teamwork spirit, your adaptability, can only be developed through real life experiences. This exam gives you a position, gives you a direction in your life, brings you to a point where you can choose the kind of environment you will stay in. But the work to become a doctor has not ended when you have given the NEET PG examination. It has just started. You have to build upon your foundation, your book knowledge, combine it with the experiences that you gain, these life skills that you learn from your co-workers, and finally shape yourself into the kind of doctor that you want to become. The kind of doctor you become is never defined by the score on your paper. So next time you get caught up in the stress of an exam preparation, if you don't get the scores that you were hoping for, don't sweat it. Remember, medicine is a long road and there is a lot of ways to make an impact. Your journey is just beginning. Keep at it, keep learning. You've got this. If you liked any part of my video, please hit a like button. And if you want to say more about anything that I have said in this video, drop down your comments. Bye bye, meet you in my next video.